Okay, so if we're working at the anterior surface of the body, one of the most common things that we see is the forward head posture, tension through the anterior cervical flexors, the pecs being tight, anterior shoulder being internally rotated and protracted. So if you want to open this area up, maybe the person presents with a frozen shoulder or rotator cuff issue, maybe it's really more of a tight pec, maybe he was doing some weightlifting and pulled his pec. I've had patients do partial pec tears, bicep tears, so anything that tends to restrict this area. But even the posture is critical here. So many people I see with frozen shoulders remain in that slump position and wonder why it tightens up again. So you want to open up the whole area. So choosing a cup that fits that body part nicely, so I'm going to choose a medium-sized cup, squeeze out the air, start lightly. This area of the skin is a little bit thinner than on the back of the body, so you want to just go nice and easy, and I'm just assessing as I place my cup and I start my glide. Is it tighter with the superior glide, inferior glide, lateral glides? I got a little release right there. Come back, slow it down. Sometimes if you move too fast or you get over those bony prominences, the cup will tend to detach, so just free it up again. A lot of restriction people get over that anterior axillary folds. It's one of my favorite spots to work. You might want to even open that area up with positioning. Let the arm just come out to the side, supported, and then start to work in that anterior axillary fold. Opening up the pec, anterior deltoid. Sometimes you need a little bit more lubricant, or you just want to move a little bit more slowly in that area. Really tight right in here. Feel the difference?
Yes.
Especially going up. So superior lateral is tighter, which is very common. Inferior medial not so snug. And gliding and opening. Place again. And if the cup keeps coming off, re-lubricate the area and or choose a smaller cup. You could add some range of motion to it as well. Place the cup in the tight area. Now you're going to just bend your shoulder backward and forward and back. So if you're working on some rotation, can you see the shoulder okay in the arm? Mm-hmm. The cup gives you an extra set of hands, and then I could stretch. So notice you're getting a little bit more reddening now over that area, so I don't like to leave them there too long. You could work with the cups that have a little bit less suction. And I find that this style of cup has less suction. So if you're going to do some range of motion, let me get a couple extra of the small versions of these. I could place these cups in the tight area, say the posterior shoulder, anterior, superior, and a smaller cup because they don't suck very well in that area. Deltoid attachment. So come on up so you can see around here. And you can go through some range of motion with the cups in place. If they come off, just reposition, squeeze, and reposition. And you could go through the range of motion to mobilize the shoulder. Check it out, especially getting into some abduction. So it gives you an extra set of hands and a little extra grip, especially you want to loosen up in this area. You could easily reposition a cup, get into an area you want to really open up. Comes off, reposition. Sometimes you get a little oil on your hands. It's a little difficult to grip. I often recommend to use gloves when you're using the cups because the gloves give you much more grip to handle the cups. Flexion. So you get a nice range of motion, and as you move, if you're using a light suction, the cups will tend to detach. So check how much suction you need, but you can see that he does have some of those telltale ecchymosis marks here from leaving them for more than several seconds. So it's a nice way to open up the shoulder.